This sketch is about the posterior rib tender points. To reinforce the posterior portion of this drawing, we have placed some posts here in the background. Ribs from the carcass of a large animal will be drawn in this sketch front and center to reiterate the point that these tender points are specific to ribs. These points are in the thoracic vertebrae, so you will see Thor with an axe. Instead of wearing a cape, he will be wearing suspenders that will fall more closely to where these tender points are found along the posterior rib angles. The first tender point in our sketch is PR1. PR1 is treated with extension, side bending away, and rotating towards the point. So we refer to that treatment as E-Smart, and we use Einstein to help us illustrate it. Thor is holding a bowl of soup in his hand because the patient should be treated supine. The remaining tender points, PR2 through 10, are treated with Sahara, seen here as the Sahara Desert. This group of tender points is treated seated, so we have Thor with an axe in his suspenders sitting and leaning against a palm tree. To treat a tender point with the patient seated, you need to increase the treatment time from 90 seconds to 120 seconds to allow for adequate relaxation. So that this important piece is not overlooked, there is a mile marker sign here with 120S drawn in. These are the posterior rib tender point treatments. Short, sweet, and simple.